When you're scheduled, if you've never had a joint replacement done before, you will be presented some options for workshops that are available to help you understand everything that's going to happen. We have the workshops in our office. Those occur on Thursday evenings, and you will be given a brochure which explains when they are and exactly where they are. The hospital offers a workshop on Thursdays, and those are from 9 till 12 in the morning. There's no charge for any of the workshops. They do, however, want you to call and register so that we do have a head count. You will also be presented a lab order. We would like your labs done at Mary Immaculate Hospital where the surgery is going to be, and the lab should be done 4 weeks before the surgery date. We never expect abnormalities in the labs, but in case there are any, that gives us time to work with your doctor on correcting anything that can be. You will be requested to get a clearance from one or more doctors. If you see a cardiologist, you will be asked to have a cardiac clearance. If you are on any of the blood thinning products, that would include Xarelto, Coumadin, Warfarin, or any of the others, your doctor will be asked to clear you to be off of that medication for 5 to 7 days. When we schedule the surgery, you will be scheduled for a surgery date, but not a time. I will call you the work day before the surgery to give you the time of your surgery, and if your surgery is on a Monday, you will be called on Friday. A post-op appointment will also be scheduled at this time. We try to schedule the post-op appointments with Dr. Carter, but if he is unavailable, in order to keep you on track for your care, you will be scheduled with one of the physician's assistants. That would be Jenna or Sean. You are not to eat or drink after midnight the night before your surgery. Diabetics will be placed first on the schedule because they cannot eat or drink, and they should not take any of their diabetic medicine on the morning of the surgery. You need to have someone drive you to the hospital on the day of your surgery. This person needs to stay at the hospital while the surgery is performed until you're out of recovery into your own room. Once you're in your own room, if that person would like to leave, they can. They need to come back to give you a ride home. For most surgeries, it's a one-night overnight stay, but Dr. Carter will decide while you're in the hospital if you need to stay longer. That person needs to give you a ride home upon your discharge, and you are not to drive for 2 weeks after the surgery until you come in for your post-op appointment. When you go to the hospital, either for your testing or for the workshop, you will be provided with an antibacterial wash that you need to use. This is what they do now. It's one of the protocols that we have for MRSA protection. They will give you the instructions and they will give you the wash. It is a 3-day process. The morning of the surgery, you are not to shower or bathe before you leave your home. They're going to have you do another antibacterial wash at the hospital before they take you back for surgery. You are also not to use any lotions, powders, colognes, deodorants, and for any of the ladies, you are not to use any makeup, nail polish, or hairspray. You are to bring only your insurance card and a picture ID. Don't bring any jewelry or valuables to the hospital with you. Other than the actual blood thinners like the Coumadin or Warfarin, if you are on any blood thinning products, and this would include vitamin E, glucosamine chondroitin, krill oil, fish oil, coenzyme Q10. If you are taking any herbal supplements, we would like for you to stop those 2 weeks before the surgery. If you're on any anti-inflammatories, and that would include Celebrex or Voltaren, you are to stop those 1 week before the surgery. The last week before surgery, you can take Tylenol. No alcohol products for 24 hours before the surgery. And if you are a smoker, we ask you not to smoke for a few days before the surgery. Discharge planner at the hospital will set you up for home health care for after your surgery because you are not driving at this time. Home health care will come to your home for 2 weeks. When you come in for your follow-up appointment, it will be determined if you need to have more physical therapy than what you get during that 2-week time. It's really important to note that you are not to have any dental work for 6 weeks prior to the surgery or for 3 months after the surgery. And dental work does include cleanings of the teeth. For 1 year after the surgery, if you go to the dentist, you need to be pre-medicated with an antibiotic. Approximately 1 week before your surgery, you will get a call from the nurses at the hospital and they will do an interview of your health history. If you have any questions, you can always call Dr. Carter's nurses at 873-1554. It's extension 430, and you can always call me, 327-0109.